The Health Secretary has pleaded with doctors to end their walkout, promising to enter into talks within 20 minutes.
But is there any chance of that? Well, GB News' presenter Patrick Christys spoke with striking doctors at St Thomas's Hospital in London.
There's never a good time to strike. There's no winners in strike action. We'd much rather be at work, and we'd much rather have a deal on the table that looks at restoring our pay over a series of years to be able to actually rectify the issues.
You know, we should be able to provide like very good quality, high quality public services, and if you want quality, you've got to pay for it. It's not free, you know.
No one wants to be here a day longer than we need to. This is the first strike of 2024. Let's hope it's the last.
Well, let's talk to former NHS Trust CEO Dr Peter Carter. Good to see you this morning, Peter. What is your stance on this? I mean, we are seeing places, as I said, particularly in Nottinghamshire, where the hospitals are going into absolute meltdown at the moment. This just isn't sustainable.
No, you're right. I mean, this is always the most difficult time for the NHS. And obviously the strikes have compounded this. And I think it's important that, I mean, the people in Nottingham have declared this critical incident, and I'm assuming that representatives from the junior doctors have been in and looked at the evidence. I can't believe the people in Nottingham are shroud waving or it's brinkmanship. So I think it's important that people see the evidence. A critical incident is declared when a trust, a hospital, genuinely believes there's an immediate threat to life. So this is a very worrying state of affairs. The hospitals are declaring this, but the junior doctors are saying they haven't seen the evidence. There's got to be a middle ground somewhere on this, but it's a very worrying state of affairs.
It certainly is, Peter. I mean, the Health Secretary has said that she'd be willing to meet the BMA within 20 minutes for more talks. Why don't you think the BMA wants to get round the table?
Well, no, I actually think what the Secretary of State is saying is that she will meet with the BMA, providing they call off the strikes. They're clearly at this stage not going to do that. So what I would say to the Secretary of State is set that principle aside for the greater good and get the BMA, the junior doctors' representatives, into the negotiating table today and see if you can cut a deal. Put something on the table, and bearing in mind, at one end of the spectrum, what they're asking for currently, a junior doctor is on, a newly qualified doctor is on £15 an hour, and I understand what they're saying is they want that upped to £20 an hour. And that doesn't seem to be an unreasonable demand. I know it gets more complicated as you get with more senior people, but I think there must be a way of providing an accommodation. And this is where you need the leadership to be prepared to swallow your pride and say, yeah, although we had that principle of no talks while the strike is going on, because of the critical state that we find ourselves in, we're going to set that aside. It's not a climb down. It's a pragmatic way of trying to get the BMA in. Let's see if we can cut a deal. And at some stage, the BMA will put that to their members. And there's also the option of ACAS. We're not hearing much about arbitration. Someone somewhere has got to blink and be prepared to show the leadership on this. And right now, I think the onus is on the government to make that decision.
What about the moral element of this, Peter? We get a lot of people getting in touch who are just very angry because although junior doctors may have a point to make, they may have a legitimate argument, that's not for us to say. What is clear is by taking this action, they do put lives at risk. Those of us who pay for the NHS, some at least, will suffer as a result.
Look, I agree. I mean, we're in uncharted territory here. Never seen anything like this before in the 75-year history of the NHS. And, you know, the reality is, if tens of thousands of junior doctors are not working, it will impact on patient care. And for some people whose appointments have been cancelled, potentially this could be catastrophic. So there's a moral and there's an ethical issue here. Now, I speak to junior doctors a lot, and what they say to me is, look, these things are going on all the time anyway, and if we don't take this stand and we keep losing junior doctors, the current situation will get even worse. Now, I was brought up to believe that two wrongs don't make a right, but we are in this classic Mexican standoff, and it's incumbent now on the government to show the leadership, to have the moral fibre to say, we are going to get you in and see if we can resolve this. But I completely take your point that people are suffering. That's irrefutable. But as I said a few moments ago, two wrongs don't make a right.
OK, Dr. Peter Carter, thank you very much.